Are you already in perimenopause? 7 signs most women miss. There is a phase that most women go through, often for years, before they ever hear the word perimenopause. During this time, their sleep gets worse. Their moods feel harder to manage. Their periods become unpredictable. And most of the time, no one connects the dots. That is what this video is about. Perimenopause can begin up to 8 years before your last period. And it comes with a very specific set of signs, 7 of them, that are almost always missed. By the end of this video, you will know what to look for. So what exactly is perimenopause? Let me explain it simply. Menopause is the point where your periods have stopped completely, for 12 months in a row. That is the finish line. Perimenopause is everything that leads up to it. The years when your body is gradually shifting from its reproductive phase into a new normal. During this time, your ovaries start producing less of 2 hormones, estrogen and progesterone. But here is the important thing. This does not happen in a straight line. The levels go up and down, sometimes quite sharply, before they eventually settle lower. And it is those fluctuations that cause almost everything we are about to discuss. Most women enter this phase in their early to mid-40s. Some begin in their late 30s. The average length is 4 to 8 years. So by the time your periods actually stop, your body has often been sending these signals for a long time. Here are the 7 signs worth knowing. Sign 1. Changes in your menstrual cycle. The first sign is a change in your periods. Not that they disappear, just that they become different from what you know. Your cycle might get shorter, 25 days instead of 30. Or it stretches out to 35 or 40 days. Your flow might be heavier one month and much lighter the next. You might occasionally skip a period entirely. This kind of unpredictability is one of the earliest and most reliable signs that your hormones are no longer running on the schedule they used to. If your cycle has shifted noticeably, and you are in your late 30s or 40s, it is worth mentioning to your doctor. On its own, it might not seem like much, but combined with other signs on this list, it starts to tell a clear story. And if you are over 45, your doctor does not need a blood test to confirm perimenopause. Symptoms alone are enough, according to current clinical guidelines. Sign 2. Sleep that does not work anymore. The second sign is sleep that just does not work the way it used to. You might struggle to fall asleep. You might wake up at 2 or 3 in the morning and lie there for an hour. Or you sleep a full night and still feel exhausted when you get up. Some of this is caused by night sweats, which we will get to in a moment. But sleep can be disrupted during perimenopause, even without the sweating. The hormone fluctuations themselves affect how deeply you sleep and how well you stay asleep. If your sleep quality has quietly gotten worse over the past year or two, and there is no obvious explanation for it, that pattern is worth paying attention to. Sign 3. Mood changes that feel out of place. The third sign is mood changes that do not quite make sense. When estrogen fluctuates, it directly affects the chemicals in your brain that control how you feel. That is why many women suddenly feel more anxious, more irritable, or just off, even when nothing in their life has actually changed. You might find yourself snapping at people and not knowing why, feeling a low-level anxiety that was not there before, or a flatness. Not quite depression, but a sense that things feel heavier than they used to. This gets misread all the time. Many women are treated for anxiety or depression during this phase, without anyone asking whether hormones might be part of the picture. It is an important distinction, and one your doctor should explore before drawing any conclusions. Sign 4. Hot flashes and night sweats. The fourth sign is hot flashes and night sweats. You probably already know about these. A sudden wave of heat, usually from the chest up. It lasts a few minutes. Sometimes it comes with flushing and sweating. At night, it can wake you up drenched. What drives this is the effect estrogen has on the part of your brain that controls your body temperature. Think of it as a thermostat. When estrogen swings, that thermostat becomes unreliable. It fires when it should not. Not every woman gets hot flashes. But if you are getting them, particularly alongside the other signs we are discussing, they are telling you something. One thing I want to mention here. Some women look for non-hormonal support for hot flashes, either while waiting for a medical assessment or as an additional option alongside other approaches. There is a supplement called soy isoflavonoids, plant compounds that interact with estrogen receptors in a mild way. Studies suggest they may help reduce the frequency of hot flashes for some women, though the effect is not the same for everyone, and not all products are equal. If you want to look into this, I have linked a product in the description below. And as with any supplement, please speak to your doctor first, particularly if you have any history of hormone-sensitive conditions or if you use any medication. Sign 5. Brain fog. The fifth sign is what many women describe as brain fog. You go to say a word and it is just not there. You walk into a room and forget why. You sit down to focus on something and find it much harder than it used to be. This is real, and it has a hormonal basis. Estrogen has a direct effect on how the brain works, on memory, and on the speed at which you process things. When estrogen starts to fluctuate, some women feel that shift quite clearly. Add disrupted sleep on top, and the effect is worse. If your mental clarity has quietly shifted over the past year or two, do not automatically put it down to stress or getting older. It may be part of this same picture. Sign 6. Heart palpitations. The sixth sign is heart palpitations, and this one surprises most women. You suddenly become aware of your own heartbeat. A flutter, a thump, a brief racing feeling that comes out of nowhere. It can be alarming the first time it happens. In perimenopause, this is often connected to how estrogen affects your nervous system and the way your heart rate is regulated. When estrogen is fluctuating, that regulation becomes less steady. Now, palpitations should always be checked by a doctor. They can have heart-related causes that have nothing to do with hormones, and those need to be ruled out first. But if your heart has been cleared and the palpitations keep coming, the hormonal connection is worth discussing. Sign 7. Joint pain and stiffness. The seventh sign is probably the most overlooked one on this list. Joint pain and muscle stiffness. Estrogen has an anti-inflammatory effect in the body. It helps keep your joints working smoothly and your connective tissue healthy. When it starts to drop and fluctuate, some women notice a creeping stiffness, particularly in the morning or after sitting still for a while. Hips, knees, fingers, shoulders. This almost always gets blamed on aging, or posture, or not moving enough. And sometimes that is genuinely what it is. But if joint discomfort has appeared, or noticeably worsened, in your late 30s or 40s, without a clear physical reason, perimenopause belongs on the list of things to discuss with your doctor. So let me bring this together. Perimenopause typically starts 4 to 8 years before your last period. The 7 signs we covered today are irregular cycles, disrupted sleep, mood changes, hot flashes and night sweats, brain fog, heart palpitations, and joint pain. These symptoms are common. They are real, and most of them can be addressed, but only if someone connects the dots. If several of these sound familiar, the most important step you can take is to have that conversation with your doctor. You do not need to wait until your periods have stopped. In fact, the earlier that conversation happens, the more options you have. And if hormone therapy comes up in that conversation, it is worth knowing that the current evidence shows it does not reduce overall life expectancy. Many women carry an outdated fear about that, and it sometimes stops them from seeking help they deserve. If this was helpful, please subscribe. We cover evidence-based health topics for women and men in their 30s, 40s, and beyond, without the alarm, without the noise. Leave a comment below. Which of these 7 signs did you not expect to see on this list? The most asked questions from comments become the next video. And if you would like a monthly summary of what we publish here, you can sign up at VardIQ.com. The link is in the description.